Good afternoon. This is Michael Osterlink, and I'm pleased to have Dr. Ameling talking with us today. Welcome back, Dr. Ameling.
Hi, Michael.
Last time we had you on our show, you talked about practice guidelines. Are they sound science or marketing hype? A great conversation. Today, I'd love to pick your brain on your vision of a tree-free market in medicine and how it can get there. We're hopeful that Obamacare will be repealed by the Supreme Court this summer, but that does not leave us with a free market. As you know, there's been multiple government interventions in the marketplace over the many years. So even without Obamacare, we do not have a free market. But lay out a picture of both some of the things we could do to get there and what it would actually look like if we had freedom for doctors and patients.
Great. Well, I think before I give you my 7 or 8 points, I think that what you said is extremely important, which is that we do not have a free market in medicine, except in certain very narrowly defined areas. And in those areas, things work extremely well. And let me give you some examples of those. Cosmetic surgery. The cost of cosmetic surgery has been stable or declining. Why? Because it's not paid for by third parties. The government's not involved. Physicians set their fees, and they charge what the market can bear. There's a lot of competition, and that keeps prices down and actually brings them down in certain areas. Another good example is LASIK eye surgery, which started out at about $3,000 per eye and is now down to about $300 per eye. Again, this is not covered by insurance or government, and doctors compete on price and quality. The technique has also improved. So these are examples of how the free market system could work, but these are almost the only examples. The other area is the true fee-for-service, cash-based practice or concierge practice without third-party involvement. Here, again, prices are very moderate. There's competition for patients, and this keeps the prices very, very constrained. So that's the good news. The bad news is that the government has, since World War II, been intervening heavily in the healthcare marketplace. And all of the problems, not just most, all of the problems that we currently face can be traced to various government interventions into this marketplace. And I'll just give you a quick rundown of where that started, which was the price controls during World War II, which led to health insurance being offered as a cash benefit, as a non-cash benefit, I should say, to keep employees happy and to lure employees into companies because they couldn't offer them more wages. And this was given preferential tax treatment by the IRS. In other words, the money spent on the health care was not taxed to the employer or to the employee. After the price controls ended at the end of World War II, the system continued. And this led to the anomaly of people buying their health insurance coverage at the workplace. And there's nothing else that we do this for. We don't buy our homeowners insurance or car insurance at the workplace. And this has led to the growth of the third-party concept where people feel like they're not paying for their care, that somebody else is paying for their care, and has also diminished the choice of individuals to buy health care plans that meet their needs. So it's become a restrained marketplace with few options, and the cost of the insurance that has been provided keeps going up. That takes a bigger and bigger chunk out of your cash pay. So it's contributed to wage stagnation over the years. With the advent of Medicare and Medicaid, third-party payment took off in a big way, created tremendous demand, which drove up prices, and led to the spiraling out of control of healthcare spending in this country. Ultimately, this led to various schemes to keep the prices down, such as price controls on physicians, price controls on hospitals, different ways of paying hospitals based on a diagnosis as opposed to the care given, and things like that. And none of these things, of course, work, which is why Medicare is virtually bankrupt. The trust fund predicts it's going to be bankrupt formally within really a few years. So that's the backdrop. The government.
Actually, Dr. Amlin, before you jump into a positive vision, another question around the backdrop. Pharmaceuticals, I find it very interesting. I'm surrounded by technology. I have my iPhone, my iPad, my laptop, and they are becoming so less expensive over time that many more people can purchase these things. So in the case of technology, the prices are dropping tremendously, and the efficiency and effectiveness of any of the products are improving over time. Now, it seems to me it's opposite, for example, of what's happening with pharmaceuticals, where their prices continue to rise, and even we can question some of the effectiveness and usefulness of some of these drugs, but that might be for another conversation. But talk to me a little bit about why the prices of drugs are increasing as they are.
Well, there was just a very good article about this by my colleague Avik Roy writing in the Manhattan Institute Journal online, analyzing the effect of the FDA on rising costs for drugs. And clearly the FDA has contributed to the increased cost of developing a drug and bringing it to market. And that is one of the major drivers of the drug costs right now. The other driver is the very limited patent protection time that the companies have to recoup their investment. Now, I'm not a special pleader for the pharmaceutical industry by any means, and I question some of their practices at times, particularly when it comes to things like guidelines, which we covered in the last interview.
Right.
However, they do come up with some good products every now and then, and I think that we would be hard put to do without them. Let's put it that way. Nevertheless, if you only have 10 years or so to recoup your investment, then the cost of that drug is obviously going to be very high. If you have 20 or 30 years to recoup your investment, that cost can come down. So, there are two things that should be pursued, in my view. One is an easing of the approval standards by the FDA. In fact, some have even suggested taking away their ability to keep drugs off the market. Just turn them into a rating agency so that companies would try to get their seal of approval, but it would not be mandatory to market the drug. I think this would be a very healthy thing. They cannot really screen out bad drugs. I mean, bad drugs usually don't show up until 2 or 3 years of use. So their function in that regard is very questionable. But they do require huge numbers of tests that are very expensive. Only large companies can actually pay for the research that is required to get a drug to a marketplace. So that stifles innovative companies. Most innovative companies, to succeed, have to be bought up by one of the big players, or they can never get a drug to market. This takes too much money. So and then the extending of the patent time, I think, would actually lower the cost of drugs. This idea that generics are going to be the answer is really not the case. Generics have been around. When generics are introduced, yes, the price of the drug comes down very minimally, modestly. What happens is that the profit margins for the various intermediaries, the pharmacy benefit managing companies like Medco, et cetera, that goes up with generics, but you don't really see much in the way of overall savings.
Okay, so basically the marketplace, if we can even call it a marketplace, is a mess. So lay out a vision for us for a true free market and how that would benefit both doctors and patients.
Well, it evolves from the idea that government is the problem. So therefore, getting government out of the equation is what we have to do, and this has to be done in a very sustained but gradual way, because too many people are now dependent on the current government-run system, particularly in Medicare. So let's start from the beginning. The original sin, as I said, was the employer-sponsored health insurance, which is only the result of a tax subsidy. Well, if we change the tax subsidy and just give it to the individual, not the employer, that would very rapidly lead to positive changes and would lead to much more of a market in health insurance. So that can be done. That would be a very simple adjustment in the tax code and would immediately give parity to all of the self-employed people who are paying for their health insurance with after-tax dollars, they would now be paying for that health insurance with pre-tax dollars, just like the people who are employed and get their health care through the workplace. So that's the first thing that should be done. The concept of the health savings account, I think, is tremendously good. The idea that you can put away money in a tax-deferred account that will grow, also tax-deferred, and that can be used for health expenses, out-of-pocket expenses, makes a lot of sense. It puts the patient back in charge of their health care decisions and will have an effect on costs, because people will be paying for things directly out of their account. They are going to shop around and spend their money wisely. This should be coupled with a true catastrophic insurance policy. There's no question that this idea of first dollar coverage, or virtually first dollar coverage, that many insurance plans offer, has led to an explosion of demand and a tremendous increase in the inflation of healthcare procedures. If people are using their own money first and then having their catastrophic plan kick in only for a true disaster, like they get a diagnosis of cancer, or they have to have coronary surgery, a big ticket item should be covered by insurance, not everyday expenses. If everybody agrees to pay for their everyday health expenses, like drugs, like doctor visits, simple tests, out of their health savings account, the inflation in healthcare spending would be rapidly terminated. It would come back to either flat, or it would actually start to decline. So that will be another key part, conversion to true insurance and having health savings accounts. And the health savings accounts really do need to be unfettered and unregulated. You don't need to have lots of conditions about how you use them. It would be very easy to track health savings account expenditures using a debit card type of system that already exists. And these accounts could easily be audited, and they should be very unrestricted.
When you say unrestricted, Dr. Amerling, would you then allow citizens, consumers to use their HSAs to purchase such things as dietary supplements or memberships to gyms or to see an acupuncturist, some of the more non-conventional or alternative treatments?
I think so. I really think that there's nothing wrong with that. For example, the idea that you, in the latest debacle of Obamacare, one of the things that they did was they made it impossible for health savings accounts to be used to pay for over-the-counter drugs. In other words, you have to actually go to a doctor, incur an expense of an office visit, and get a prescription for it to be covered by your health savings account. So it's again, the insanity of these mindless bureaucratic rules. We have to just get rid of them. You have to start cutting them away and get back to freedom as a concept. So health insurance at the state level, and health insurance has been strictly regulated by states until recently with Obamacare. However, the states have not been exactly benign actors, and they have imposed mandates for coverage of large numbers of things that most people probably don't need. So groups in the states lobby the state legislature to get their whatever covered, such as chiropractic care or acupuncture. Now, not that these things are necessarily bad or evil, but they are being imposed on everybody through their insurance premiums. In other words, the premiums are going to have to rise to cover all of these mandates. And, a similar thing is now happening nationally, as we've seen with the mandate to cover children up to age 26. Of course, they're not children at this point, but shall we say dependents up to age 26. That is a mandate for additional coverage, which led to an immediate expansion of premiums. Premiums went up around the country to cover this extra burden that the government imposed on insurance companies. So every mandate that's imposed on insurance, either at state or federal level, drives up the cost of health insurance, makes it much more expensive. I think there should be zero mandates for coverage. People should be able to pick and choose a policy that fits their needs and not pay for things that they're unlikely to use. So that's another avenue to get back towards a free market in medicine. And one thing that might help this along would be to end the prohibition against buying health insurance across state lines. There's no reason why you shouldn't be able to buy a health insurance plan from any vendor in the 50 United States. So that's an obvious thing that people have been talking about for years, and it would be extremely easy to do. I think that we are getting to most of it now. In terms of keeping costs under control, nothing works like the free market. We see it work over and over again. The very high price of health care is largely a phenomenon of the third party. The third party payment system fixes prices, essentially, and takes the price signal out of the equation, so there is no way for prices to move with supply and demand. Why should an MRI cost $1,000? It's completely arbitrary. In a free market system, it might cost $100. Likewise, a CT scan probably could cost $100 in a free market system. Why? Because of supply and demand and the invisible hand of Adam Smith.
Well, let me ask you also about transparency and pricing. What role do you think that would play if, in fact, patients could compare and contrast the costs of goods and services provided by various doctors or clinics or hospitals?
Well, that's an absolutely essential part of a free market system. Doctors and hospitals and clinics and radiology suites would all have to post their prices and let people shop around and buy and comparison shop like they do for everything else in the world that they buy. This system is so controlled and so regulated and so fixed that it's amazing it functions at all, frankly. It really is.
What do you think would happen to medical education, of you doctors, both in medical school and after the fact, if a lot of these rules, regulations, and laws were removed and we had a true free market? Do you think it'd have an effect on your education?
Well, this whole area, unfortunately, there's a split in professionals and doctors. I believe that in the academic centers, you are much more likely to find the government types, and in fact, most of the support for Obamacare comes from the academic centers and the academic physicians who see themselves as running the show. They figure they're going to be in charge of telling everybody else how to practice, and they won't be affected. And of course, they're on academic salaries, and they don't really see any big impact of the nationalization of healthcare, shall we say. So they're the ones that control the medical school curriculums by and large, and I'm not heavily involved with this, but I do know that there is very little education in medical school on the economics of medicine. Most doctors graduate, go through training, they don't have the vaguest idea of what it's like to run a practice. And that's something that really needs to be developed, because unless we want to have everybody working for the hospital and have the hospital administrators making all the decisions, we'd like to keep a private practice of medicine alive, and that's going to mean training people who are going to be equipped to go out and start their own small business.
Very interesting. Yeah, I would imagine that the entrepreneurial spirit, although still alive in this country, is being educated out of existence through just general schooling. Forget even medical school, where creating a business, as you're suggesting, is not even taught at all. On another front, in terms of medical education, you and I have talked about in the past kind of the influence of the drug companies, and obviously we're in favor of a free market and easier barriers to entry for drugs, so there's many more drugs on the market and such. But the influence the drug companies have over prescribing practices actually not even just the prescribing practices, but the practice of medicine and some of these guidelines that we've discussed and such. What do you think would happen if, in fact, we got rid of these guidelines, we got rid of all these rules and regulations, had a free market, in terms of the influence that the pharmaceutical companies would have over education? Because I know it's something that you and I have also talked about, is the benefits, of, say, of exercise and proper diet can deal with a lot, not all, but a lot of the problems that your patients, your cardiac patients, as examples, face, and others.
Well, that's a great point. I think that the current system of third-party payment and lack of individual patient responsibility for the upfront costs of their care has facilitated this model of care, which I think is not that great. Here's an example. Let's say you're 30 pounds overweight. Your cholesterol is 300 or more. Your blood pressure is 160, 170. You've got a pre-diabetic condition brewing. And you go to the doctor, and the doctor tells you, here, you've got to take glipizide, you've got to take Lipitor, and you've got to take some blood pressure pills, and come back and see me in a few months, and we'll check these numbers again. Well, if somebody is going to be charging these drugs to their pharmacy benefit management company, and someone else is going to pick up the tab, they probably are not going to think twice about this. They're going to go along. They're going to get the prescriptions filled, maybe pay a little bit of a copay, and start taking their pills. Are they going to get healthy doing this? Of course they're not. They're going to have slightly better numbers. There may be a marginal effect on their long-term survival, maybe not. They're not going to get healthy. Now, let's say that they have to go and buy these drugs from their health savings account, and they're going to be spending $2,000 to $3,000 a year of their precious health savings account on these drugs. Well, at that point, maybe they're going to start to think, maybe I would be better off going for a walk every day.
Yeah, right.
Cutting down my carbohydrates and losing these 30 pounds and getting rid of this pre-diabetic condition the good old-fashioned way by sweating it off. So I think that the payment system has led to the permissive and passive behaviors and sort of almost a slothful attitude towards our own health because someone else is picking up the tab. If you start to assume responsibility for these costs, I believe it's going to produce behavioral changes.
Very interesting. This is Michael Osterlink, and I've been talking to Dr. Richard Amerling. Dr. Amerling, this is really fascinating. I always enjoy having these conversations with you, especially the things around diet, nutrition, and the kind of critique of some of these guidelines and therapies and such. You've given us a lot to think about. We appreciate your time, and would love to have you back on in the near future.
Of course, Michael, anytime.